Mumps. It is a viral infection caused by Mumpsvirus. The Mumpsvirus is an enveloped, single-stranded, negative-sense RNA virus belonging to the Paramyxoviridae family. This virus has surface glycoproteins, namely hemagglutinin neuraminidase (HN) and fusion F protein. These help the virus in attachment and cell fusion. It is one of the most common cause of parotid gland swelling in children. Coming to its pathogenesis, mumps virus enters the body through respiratory droplets, saliva or fomites, that is contaminated objects. The primary replication occurs in the nasal or upper respiratory mucosa. Then it infects the mononuclear cells and the regional lymph nodes. From there, it spills over to the bloodstream, causing viremia and finally spreads to the target organs. One important point to note is that the mumps virus has a special affinity for glandular epithelium. So, it mainly affects the salivary glands, especially the parotid glands, testes, pancreas, ovaries, mammary glands, and central nervous system. And this explains why complications occur in these organs. Now, moving to its clinical features, many cases are actually asymptomatic or can be mild with symptoms like fever, myalgia, and loss of appetite. The most common specific manifestation that is seen in 70 to 90% of mumps cases is bilateral parotitis. It is the simultaneous swelling of both the parotid salivary glands due to inflammation without pus formation. So, the parotid salivary glands are enlarged and tender. This swelling is painful. Other salivary glands are also involved in some cases. In severe cases, it causes orchitis and aseptic meningitis. Epididymoorchitis is the next most common manifestation of mumps. It develops in postpubertal males. Orchitis is mostly unilateral and hence infertility is rare. Other complications are oophorytis, which is the ovarian inflammation and occurs in about 5% of women. Pancreatitis is very rare and may lead to diabetes. In atypical mumps, parotitis may be absent. Mumps is usually more severe in adults than in children. Now, moving to the laboratory diagnosis, the specimen is buccal or oral swab. However, virus can also be detected in saliva, CSF, and urine. Massaging the parotid gland before taking the swab is recommended. The virus isolation is done in monkey kidney cell lines. Cytopathic effects like cell rounding and giant cell formation are seen. Shell whale technique is a faster method. Serum antibodies are detected by using ELISA. It is highly specific. RT-PCR can also be used. It detects the viral RNA. Coming to the treatment, there are no specific antiviral drugs for mumps. Treatment is mostly asymptomatic, but prevention is the key. Live attenuated vaccine, that is Gerald strain, is the recommended vaccine strain used worldwide. It is administered as MMR vaccine, which stands for measles, mumps, and rubella vaccine. The WHO recommends a 2-dose schedule of MMR vaccine. The first dose is given at 12 to 15 months of age and the second dose is given at 4 to 6 years. So, That wraps up a high yield overview of the mumps virus.